So basically today we're going to start another important topic. Let's start with Rahim. So here we will study about the management of the epileptic patient. So what can be the causes of epileptic attacks? Okay. So basically a patient is non-epileptic but poorly controlled epileptics. Poorly controlled or non-compliance with the drug regime. The patient can have stress, hypoglycemia. The patient can be due to drugs, overdose of the local anesthesia, alcohol, and can be also the flashing lights can cause. Then we have actually signs. So we have actually the isolated brief seizure. It means basically that there is a single attack, not repeated attack. The patient start a warning cry, which basically means that the patient has just muscle contraction and he or she wants the air to be forced through a closed larynx. The patient has loss of consciousness immediate. There is tonic and clonic phase. In tonic there is rigidity and cyanosis appear, and the clonic phase there is actually a widespread jerking movements we have. Means there is actually the formation of the white fluid in the mouth. Flaccidity sometimes follow after a few minutes. The patient becomes rigid, then flaccid. Flaccidity is there present. Okay. Then basically what we have is consciousness regained after a viable period, and confusion and drowsiness may persist. Okay. How to manage this acute type of phase? Terminate all the dental treatments. Put the patient in coma or recovery position as soon as possible in straight coma or recovery. Prevent the patient from injury themselves. Okay, so when the patient is seizure, remove everything around. Means every instrument should be removed around the patient in order to prevent the injuries. Do not try to put anything in the mouth, not because it prevent the patient biting the tongue. Okay, very important. Then after seizures, patient is in consciousness. Make sure that airway is clear after convulsions. Okay, the airway patency is important. Then administer the oxygen. Observe, monitor the vital signs. Consult the physician. Observe the patient in office for 1 hour. Reassure the patient and only allow the patient when home when he is fully recovered, accompanied by an adult. Okay. Then when the patient is still in unconsciousness, then have someone medical summons the patient in on site and suction airway, monitor, then initiate the basic life support if necessary, oxygen administration, and transport emergency care facility. What happens when the statistic epilepticus happens to the patient? So basically what happens, when there are, the first one was actually a single. When there are repeated attacks and convulsions do not stop within 15 minutes and rapidly repeat, the patient in statistics epilepticus. Okay, and can die due to anoxia. Anoxia basically complete absence of oxygen. How to manage this patient? Now you will give the drugs. Diazepam 5 mg IV to 10, or metrazolam, which is 3 mg per minute IV or IM, up to 6, titrated until seizures stop. Adult patient. Total dose cannot be double if no signs of respiratory depression occurs. Okay, means they are saying if the total dose can be doubled if no signs of respiratory depression occurs. Okay, total dose should be halved in children and older patients. Maintain airway, give oxygen, have someone medical assistance. Once the seizure stops, place the patient on site, suction airway, monitor the vital signs, give the basic life support, and administer the oxygen, and then transport to the emergency care facility.